I'm Stanley Jones. I'm an orthopedic spine surgeon, and I've been doing orthopedic spine surgery for 35 years. I've been great. I've had no problems. I've been able to function perfectly. And then one day in 2004, I fell down my stairs and hurt my right hip. My hip hurt so badly that I was on crutches for 3 weeks. And then I got better. I didn't even think about my hip anymore. And then 4 years later, my hip starts hurting, and I have horrible degenerative arthritis of my right hip. I was needing a total hip. But in the process, I developed this awful autoimmune arthritis that took me down. It took me to a lower level than I've ever been. I had so much pain. I was in bed. I couldn't function. I couldn't even start my car even when I got to where I could get up and go. So I was really debilitated. I was really depressed. I didn't know where I'd go. I crawled in the corner and wanted just to quit. Here I was, an orthopedic spine surgeon, extremely busy, taking care of patients every day. And then I couldn't do it anymore. I couldn't even go to the office. I couldn't see my patients. I darn sure couldn't operate. I had to get these stem cells. I had to try something. And lo and behold, it worked. I got injections in my right hip. I got injections intravenously. And in 3 months, my right hip didn't hurt anymore. And in 5 months, my arthritis went away totally. I was euphoric. It was like one day I woke up and I went, wow, I don't hurt anywhere. I couldn't believe it. And I became so euphoric that I knew I had to do something for everybody else in the world that had my problem. And so I started the search for a way we could put stem cells in America. And I got with David Eller, an old friend, great businessman. So he and I decided we should do something to help people. And we put Celltex Therapeutics together. We put together a great team. We had a great lab group. And in our lab, we started growing 200 million stem cells at a time that was just unheard of here previously. We had technology that wasn't ever available here. There are other companies that are doing stem cell therapy, but it's not done the way we're doing it. We're having to grow stem cells for 6 or 8 weeks to make stem cells plentiful enough for your body to absorb and have it and make a difference. Some people advertise that they're using stem cells currently in America, but small doses of stem cells. If you take bone marrow, you take fat, and you extract the fat or you extract the bone marrow and you spin it down and separate it, and you can get stem cells. But it's very small numbers of stem cells. We're talking in our technology, Celltex technology is like 200 million at a time. This technology is maybe 50,000 at a time. So it's significantly different. We've treated people of various ages. Our oldest patient's 96 and our youngest patient is 6. The 6-year-old is the poster child for the American Arthritis Foundation because he has juvenile systemic rheumatoid arthritis. He's gotten better with stem cell therapy, and he now is able to function like he's never been able to function before. With that being said, we at Celltex feel like we've accomplished more than anybody else. We can give somebody genetically identical stem cells that are morphologically perfect. They're identical. They're just like your own stem cells in your own body. And with those stem cells, we've made people better. That gives people hope. It gives me hope. It gives us all hope that we can make people better forever.